For our policy analysis project, we focused on the lack of mental health resources. The definitions of mental health and mental health services evolve with advancements in medicine and history. The World Health Organization currently emphasizes that mental health includes a lot more than just the absence of mental illness. Mental health is defined as a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, and can work productively and is able to make a contribution to his or her own community. Similarly, mental health services can be described as the assessment, diagnosis, treatment, or counseling in a professional relationship to assist an individual or group in alleviating mental or emotional illness, symptoms, conditions, or disorders. Though problems within mental health resources are abundant, difficulty providing and accessing services remains at the root of how mental health is addressed in our country. In the U.S., half of those suffering from mental illness receive no treatment at all, leading to worsening conditions, safety concerns, and lifelong struggle. Access to existing services remains limited, fragmented, and complex. Many providers choose not to accept insurance plans because of the low reimbursement rates and high administrative burdens. This leaves in-network providers in high demand with long wait times and limited options for further referral. Consequently, patients are forced to go without or seek out-of-network care, paying for services out of their own pockets if possible. All of this leads to a heavy burden on emergency services and dismissal of the root causes and prevention strategies for mental illness. Compounding the problem is the fact that mental health services are increasingly high demand. The history of mental health resources and early mental health treatments and policies were driven by independent scientists and religious leaders, with practices such as institutionalization, lobotomy, and exorcism. As research evolved, mental health became officially recognized as a medical discipline. Effective medications began to emerge, and emphasis was placed on providing equality and respect for the mentally ill. As a result, institutions were dismantled. As patients were released, the U.S. had big dreams of providing robust community health services. But without adequate funding and infrastructure, many of the mentally ill ended up homeless and destitute. By the 1990s, data about neurotransmitters, genetics, brain mapping, and more began to guide policy, increasing understanding and framing mental health as an integral part of overall well-being. Recently, substance abuse has also been included in the treatment of mental disorders, and legislation such as the Affordable Care Act and health parity laws have attempted to expand coverage for mental health services with varying degrees of success. Unfortunately, some of the opinions of mental health from earlier in history still remain in our society today. This causes those struggling with mental health to be ashamed and avoid accessing the resources available to them. If the country can learn to accept all illnesses, whether they are physical or mental, then there will be even more support to create more mental health resources. And this is a video you can watch later done by the Colorado Children's Hospital. As shown by the demographic, depression is present in all groups. It occurs within all ethnic groups and is the highest in those with a sexual orientation that is not heterosexual. Unfortunately, the group with the highest rate of depression has the least amount of mental health resources. This group is the LGBTQT group. Studies show that even trained mental health professionals are lacking in the proper training to help this population. This is a major problem in the United States. If those who need mental health help the most cannot receive the proper therapy, they are at a much higher risk for self-harm and suicide. Another alarming statistic is the increased rate of depression in teens. Depression is becoming more common for this age group, and along with that, suicides are increasing as well. These groups need a great amount of focus and therapy so they can learn to cope with depression through their adult years. 3 alternatives and solutions that we've come up with are increased rates of insurance reimbursement. This encourages a greater number of private practitioners to accept insurance. It also incentivizes the incorporation of mental health into primary care. An increase in mental health practitioners is necessary because demand for services is on the rise. Researchers point to the increased awareness of mental health conditions, initiatives that encourage seeking treatment, and the prolonged burdens of conditions like substance abuse and severe mental illness on healthcare resources. Many physicians currently report barriers in referring patients to specialists or for additional assistance because there simply are not enough providers. Citing the lack of existing services, another solution to the problem is to expand the resources we already have. For example, outpatient counseling sessions, even provided just once, have shown to reduce individual mental health symptoms, increase coping strategies, and reduce the need for emergency care. Expanding networks of counseling services, community health organizations, school counselors, etc., would help meet the expanding demands for care. Going along with that, one of the most needed changes in mental health is to get visits covered by insurance. The outcome of this would be life-changing for those with mental health needs. As described by Mason, Gardner, Outlaw, and O'Grady, money talks, and an out-of-pocket bill can be the difference between someone seeking help or declining because they cannot afford it. If more insurances were willing to accept mental health as a medical need, the outcome would result in more people getting treated. Along with that, there is a shortage for mental health clinics. Patients must wait weeks to be seen at times because there simply is not enough room to accommodate the mentally ill. If the mental health workforce was increased, there would be more opportunities for those in need to get in quickly. This can be the difference between life and death for those struggling with suicidal ideations. Finally, the expansion of existing services is a need. In medical school, students must learn thousands of different diseases and their processes. Unfortunately, mental health is not a main focus for physicians, even though many of their patients will have problems in this area. Studies show that even though primary care physicians feel an increased need to be better educated with mental health resources, there are also feelings of decreased confidence in mental health teaching and inability to find time to help patients with mental health. Not only do we need more access, but we need more healthcare providers to be prepared to handle mental health situations. Changes like the ones proposed in this presentation have positive and adverse consequences for the healthcare systems and healthcare policy. Healthcare systems could benefit from wider coverage of patients with mental health challenges. Mental health providers would experience less personal burden and heavy patient loads, while being able to refer patients to a broader range of available services. With increased treatment, overall cost of mental health treatment and impact on the system, such as frequency of ER visits for mental health emergencies, could be significantly decreased. Healthcare policy would need to be reworked in order to ensure providers received increased reimbursement for their services. In addition to having more providers to reimburse, which governments and insurance companies may oppose, additional funding would be needed to shore up and expand existing resources in order to support other efforts towards expansion of care. Of all the things that need to be done, the most important and final recommendation is to increase the insurance reimbursement for mental health workers. This leads to access for more individuals who will all benefit from mental health resources. This is not an easy task to complete, but if started from local resources, the outcome would have a chance of success. It is important to network and use whatever resources available to help the idea reach the representatives that can make the change. To start, nurses have the responsibility to be involved in the community. As nurses, we can join a local group that supports mental health. Groups such as the National Alliance on Mental Illness has footing in Utah. Having many individuals who are passionate about the same cause helps to create a stronger voice. Once a plan is made through this group, a presentation could be put together and presented to people of higher status. An option could be to attend a monthly meeting such as the Board of Nursing. There are people willing to listen to ideas and help other nurses achieve goals. Working with individuals involved in state groups helps to get the word out and opens up doors to governmental leaders. Through networking and more support, the word could be passed on to Utah representatives where the situation could be analyzed and voted on. This change would take work and patience and is not something that would happen overnight. Fortunately, one person can start a change, and through perseverance, this outcome would have a chance of succeeding. One study in Canada identified factors that have been proven important in monitoring improvements in mental health. The study's 5 determined criteria are state of current mental health, happiness, life of satisfaction, and overall psychological and social well-being. These factors could be tracked via interviews or self-reported surveys administered at primary care visits. It could also be helpful to closely track statistical data about mortality, morbidity, and ER visits related to mental health conditions in order to determine if policy changes were affecting individual health outcomes and health behaviors. Because mental health outcomes have such a widespread effect on many areas of everyday life, including family life, public health, education, earning power, and much more. The breadth of data could be collected in relation to this issue is vast and could require long-term monitoring across many disciplines. Overall, we believe that mental health is an extremely important need in our country today, and there is definitely a lack of mental health resources, and it is important that we get the word out and that we start making changes in this area so that more people can receive the treatments and the help that they need.